A very good day to you guys. Today we'll be talking about hemophilia. Our previous video was on von Willebrand disease, and today we'll be talking about hemophilia. Okay, hemophilia and von Willebrand disease are actually somehow like alike. Okay, and don't get them twisted. All right, because they are actually different things. All right, so let's proceed to the next stuff. I would say that hemophilia is a sex-linked disease and inherited a blood disorder, and it is characterized by prolonged clotting time. Okay, however, the bleeding time is normal. All right, you bleed, it stops, but it does not clot. That's something crazy. Okay, usually it affects males and females. Okay, it affects males. Okay, and females are the carriers. So you could actually not have it, but your wife can be a carrier. And when you give back to your sons will actually be down with this medical condition. All right. So because of prolonged clotting time, even a mild trauma causes excess bleeding for long, and this can lead to death. All right. Just a mild, just a mild trauma on your skin can cause excess bleeding, and this could lead to your death. All right. So this is an example of normal blood clotting. All right, and this is inability to clot. All right, inability to clot. This is a normal blood clotting, and this is inability to clot. Inability to clot, you see that when your blood vessels when they rupture, the platelets don't aggregate, they don't clot again. Okay, and this is normal blood clotting, that your platelets aggregate and form clotting. Now let's continue. I will say that damage of skin while falling or extraction of tooth may cause bleeding for few weeks. Okay, and easy bruising and hemorrhage, in muscles and joints are also common in this disease. You easily bruise, and when you bruise, your bleeding time is normal, but your the wound don't clot. Okay, this is another, just an image showing blood. Okay, blood transfusion, antibodies and stuff. Okay, I think this is a healing, these are treatments of this hemophilia that we are talking about. You can see the factor 8 there. The factor 8 can be injected in your body, and everything is going right. So what are the causes of hemophilia? Now, hemophilia occurs due to the lack of prothrombin activator, and that is why coagulation time is prolonged, because your prothrombin activator is not there. And formation of prothrombin activator is affected due to the deficiency of factor 8, factor 9, and factor 11. Okay, hope we are following up. Your prothrombin activator is affected. That's due to the deficiency of factor 8, factor 9, and factor 11. Now, your hemophilia is divided into hemophilia A, hemophilia B. Why are they doubling up? It's just hemophilia A and hemophilia B. Okay, this should just be like the starting stage, and this one should be the chronic hemophilia. Okay, so let's continue. So there are types of hemophilia. I would say that hemophilia A. Okay, sorry. This is actually hemophilia C. Okay, you correct that. Actually, hemophilia C. Alright, so hemophilia A. It is also known as a classic hemophilia, and this is due to the deficiency of factor 8. Remember, we said factor 8, factor 9, and factor 11. So just counting them like that, A 8 is A, 9 is B, factor 11 deficiency is C. So simple to grab. And so factor A, this is also known as the classic hemophilia, and this is due to the deficiency of factor 8. Okay, it's due to the deficiency of factor 8. Now, hemophilia B or Christmas disease, this is due to the deficiency of factor 9, and this causes like 15% of the disease. Is if you in let me say, if you gather like 100% of hemophilia cases, 15 cases should arise from hemophilia B, which is due to the deficiency of factor 9. Okay, then hemophilia C or factor 11, this is due to the deficiency of factor 11, and it is very rare. Okay, and hemophilia A is due to the deficiency of factor 8, and is 85%. Okay, so let's go on. This is signs and symptoms of hemophilia. You say that your soft tissues they bleed and they easily bruise. I see that the iliopsoas bleed. Okay, I see that your thigh and your calf they bleed. I see that your buttocks bleed. Okay, I see that your deltoid and forearm bleed. You see that your neck swelling, your neck will swell. I see epistaxis. Okay, I see prolonged headache. All these are symptoms of hemophilia. Now let's talk about the symptoms of hemophilia that we have here. You see that there's spontaneous bleeding, okay, from your nose, where you just keep your nose down, before you know, you just start bleeding. And there's prolonged bleeding, okay, and there's hemorrhage in gastrointestinal and urinary tracts, okay, and there's bleeding in joints, and there's appearance of blood in your urine. Blood appears in your urine, bleeding in joints, hemorrhage in gastrointestinal and urinary tracts, and there's prolonged bleeding, and there's spontaneous bleeding. And how about still let's talk about the factors of hemophilia. I'm coming, let me run up something in my phone. I'm run up something in my phone. I say that hemophilia, actually there's no cure of hemophilia. If you know that you have hemophilia, avoid injuries that promotes bleeding. Okay, encourage good nutrition, and your dental hygiene should be A1. You should administration of deficiency clotting factor. If you know that you are deficient in clotting factor 8, they could administer it to you. If you know that you are deficient in clotting factor 9, they could administer it to you. If you know that you are deficient in clotting factor 11, they could administer it to you. Okay, and when you have nose bleeding, there's prolonged nose bleeding. Okay, and there's intracranial hemorrhage, and you bruise easily. Okay, there's warm, painful and swollen joints. The joints around your hand, around your legs and stuff like that, they become warm, painful and swollen. Okay, and there's GI hemorrhage. You get to bleed in your intestine and stuff like that. Okay, now what is the treatment of hemophilia? We say that the effective therapy for classical hemophilia involves replacement of the missing clotting factor, which is typically done by injecting the treatment product. Okay, and this is called clotting factor concentrate. Okay, if you know that you are deficient in clotting factor 8, to be injected in you, clotting factor 9 to be injected, clotting factor 11 will be injected into the patient's vein. This is the classical therapy for hemophilia. Okay, so guys, with this we are done with our lecture on hemophilia. This is the MBBS Niger. If you are watching this YouTube channel and you like our medical videos, kindly do subscribe to our YouTube channel. Okay, go to Facebook, search MBBS Niger and like our Facebook page. See you guys in the next tutorial, and bye for now, guys.